Magandang umaga, Pilipinas. Good morning, good afternoon, good evening from wherever you are joining around the world. Welcome to today's webinar where we will discuss how to solve food and nutrition insecurity, transforming food systems post COVID-19. We are streaming to you live through the Circa online learning and virtual engagements or SOLVE platform via Zoom and Facebook Live. My name is Jean Labios and I am a program specialist of the Training for Development Unit under the Education and Collective Learning Department of Circa. I will be your moderator this morning. The short video shown earlier has given you a glimpse about Circa and what we do. Circa is hosted by the Philippine government in the campus of the University of the Philippines, Los Baños. So we are coming to you live from Los Baños, Laguna, the special science and nature city of the Philippines. This SOLVE webinar series is Circa's immediate response to the emerging impacts of the COVID-19 global pandemic on food security. By maximizing the use of information and communication technology platforms to inform, educate, and share evidence-based solutions and tested technologies, as well as best practices on the ground. If you're new to this webinar, this is actually the 43rd webinar since it was launched over 2 years ago on April 28, 2020. We have a rather interesting topic this morning, and we are pleased to be joined by two experts who will share their experience, expertise, and insights on the importance of rethinking the future of agriculture amidst complex and evolving challenges, specifically from what we have all experienced in the COVID-19 pandemic. Circa's 11th five-year plan, which was launched in July 2020, identifies food and nutrition security as one of the priority areas that would accelerate transformation through agricultural innovation. Before we proceed to our online conversation this morning, please allow me to quickly go over some statistics gathered from the SOLVE webinar held on 29 May 2022. The infograph shows that 71% of our online viewers were female and the rest were male. It also indicates that more than 20 individuals tuned in via Zoom and more than 90 individuals viewed the webinar through Circa's Facebook page. Lastly, we are happy to note that we've had online attendees not only from the Philippines, but also from Indonesia, Thailand, US, and Vietnam. Let me now go over the program flow, which is currently shown on your screen. After my introduction and a few housekeeping rules, we will have our first speaker, Dr. Lu Ade Ari Wiradniani, Community Development and Partnership Unit Manager of Simeo Recfon in Indonesia. She will open our discussion this morning by sharing with us the nutrition trends that emerged from the pandemic and their recommendation for balanced nutrition practices. After Dr. Ade, we have Assistant Professor Joseph Adriel de Guzman, Assistant Professor from the Department of Anthropology of the University of the Philippines, Diliman. He will be sharing with us, through an anthropological lens, insights and observations on this changing landscape on food and nutrition as a result of the pandemic. I know you are excited to listen to our speakers, but allow me to go over some instructions on how you can send us your questions about the presentations. How do you do this? For those of you who are tuned in via Circa's Facebook page, you may type your questions in the comments section. Kindly indicate your location now and or country of origin. If you are tuned in via Zoom, please post your questions or comments in the Q&A box, which you will find in the menu bar on your screen. Kindly indicate your location and or country of origin as well. Our SOLVE team will collate, curate, and compile those questions for me, and I will convey them to our speakers. Hopefully, we will be able to cover as many questions as we can in the time remaining. Please be clear when you are posing a question to a specific presenter or if it is a general question that anybody can respond to. We will do our best to get as many questions as possible during the open forum. Kindly also refrain from posting your email addresses in the comments section. You can provide this information to us upon responding to our evaluation form and e-certificate request. The link will be posted at the end of the webinar. Please note that this webinar will be recorded and will be made available on Circa's Facebook page and YouTube channel. Today's presentations will be uploaded on Circa's website at www.circa.org. The slides shown during the past webinars have already been posted there. For social media posts, especially on insights or takeaways from this webinar, please use the hashtag CircaSolve. If you have issues or are experiencing technical difficulties with the Zoom online platform, please contact us at solve@circa.org. Moving on to today's discussions, our first speaker this morning is Dr. Lu Ade Ari Wiradniani, Community Development and Partnership Unit Manager of Simeo Recfon in Indonesia. She coordinates the implementation of two flagship programs of RECFON, namely Nutrition Goes to School program, NGTS, and Early Childhood Care, Nutrition and Education, or ECCNE. These are in Indonesia and Southeast Asia. She also coordinates partnership of RECFON with other institutions at the national, regional, and global level, aiming at improving nutritional status and nutrition-related practices of people. Dr. Ade holds a master's degree in community nutrition and a PhD in nutrition, both from the Faculty of Medicine of the Universitas Indonesia. Ladies and gentlemen, please welcome Dr. Ade.
Hello, good morning. Yeah, thank you very much for the nice introductions, Dr. Jean. Magandang umaga, good morning, and selamat pagi to all of the audience. I'm very happy and very honored to be with you, to be with all of you today. I will be sharing nutrition practices during COVID-19 pandemic. And I would like to also excuse myself for turning off the camera in case I receive notification that my internet connection is unstable. And hopefully I can manage the 20 minutes allocated for my presentations to deliver all of the slides that I prepared. I would like to share the screen. Okay. Okay, nutrition practices during COVID-19 pandemic. My sharing will be consisting of three main parts. The first one is the COVID-19 pandemic and nutrition. The second part is balanced nutrition practices recommendations. And the last one will be nutrition practices during COVID-19 pandemic in Southeast Asia. Okay, let's start with the first part, the COVID-19 pandemic and nutrition. Okay, if we have a very brief flashback that the World Health Organization declared that the COVID-19 pandemic on 11 of March 2020, and since then we have done a lot of adaptations with a series of regulations coming from our governments and also at the global level coming from the WHO. To slow down the transmission rate of the virus, the coronavirus, the general mitigation measure has been settled and set and followed in most of the countries around the world. The main mitigation measure is to increase social distancing by restricting movement and also gatherings. Because of that, we are exposed to the term a new normal, yeah, a normal that is considered new. Why it is new? By definitions, new normal is defined as a previously unfamiliar situation that now becomes standard or considered as usual practices. I go to WHO websites. They have a lot of infographics telling us what new normal would look like in our daily life since COVID-19 is declared as a pandemic. These are two out of many examples of infographic in their website. So you can take a look at it if you want to go more detail. And if you see here that most of the points highlighted are something that we are not familiar, and we didn't do that, yeah, before pandemic. But during new normal, we are expected to adopt all of this and become our usual practice. The mandatory movement restriction imposed in many countries have modified a lot of aspects of our life, including our food habit and also food consumption. Food environment and food system. So food environment is a key interface between consumers, us, and the wider food system. So in early pandemic, the United Nations System Standing Committee on Nutrition have mapped the possible impact of COVID-19 pandemic, and then integrate that into the existing food environment conceptual framework that have been established before. And this is how they illustrate the possible impact of COVID-19 into our food system and later on out into our diet quality. The factors are divided into group into external and personal. External dimensions consist of availability of food in the neighborhood and the price, and also the product and the regulations. While the personal factors, personal food environment features the accessibility, whether we can have access to get the foods from the perspective of distance and also transportation, for example, while it also consider the affordability, the access to food, but in terms of purchasing power, more into income issue, economic issue. Another personal factors are convenience and also preference, yeah, desirability. All of these factors interact one another, and together it will influence how the consumer behavior and later on how the diet quality that they consume during pandemic. If we talk about the food consumption, we may need to also see how the COVID-19 pandemic impact food insecurity, especially in Southeast Asia. I take the data from the FAO website, the first point, that in general, globally, COVID-19 pandemic increases risk of food insecurity because reduced access to food, both in terms of economic factor, because many people experience reduced income or they even lost the source of their income, and also due to the regulation that we have to stay at home, so many company factories are requested to close, especially during lockdown. So then the access to get the food is disrupted. And I also take results of one study in the Philippines by Dr. Imelda and colleague, published in 2022, that a rapid nutrition assessment survey have been done in the Philippines in the end of 2020 in order to assess food insecurity status of households in the Philippines. And the finding show that 61.2% households indeed experience moderate to severe food insecurity, and the prevalence of food insecurity was 40.2% in 2019. So it means that the prevalence of food insecurity in the Philippines increased by around 20%. The study also found that the level of food insecurity peaked in April and May 2020, because the study measure across a period of time, not only one, so they can see whether or not there are fluctuations in the food insecurity. And it shows that the peak is in April and May, when the entire country was placed under enhanced community quarantine, or maybe full movement control orders, the lockdown, and then gradually decrease thereafter as the mobility restrictions is in most areas. So it becomes more food secure, yeah, when the mobility restrictions more is in most area. Okay, now we move to the second part, the balanced nutrition practices recommendation. So before we discuss about how the nutrition practices in Southeast Asia, maybe it's also good to know actually what are the recommendations. What are the recommendations, whether it is different from the before pandemic recommendation or actually they are similar. Yeah, I'm so happy to share these slides to all of you. I take this slide from the FAO websites on the food-based dietary guidelines. So food-based dietary guidelines have become universally accepted tools that give a public a practical advice and information on healthy diets to make them empower with appropriate knowledge to practice healthy eating for their health. In some Southeast Asia countries, they have adopted a visual guide because visual always have a better, yeah, if we want to get a better understanding, especially for a lay people, visual works better than a long narration. So many Southeast Asia countries have adopted a visual guide to assist in conveying the messages of balanced nutrition with different food groups and also the recommended amount. Among all the availability of visual, a food pyramid and food plates are the most common pictorial guide chosen by most of the countries in Southeast Asia. When we see these pictures, some food pyramids seems give more detailed information, while some maybe look more simple. But actually, the key messages across country in Southeast Asia share in their food guide are similar. All of them highlights the importance of variety of foods, yeah, because the more diverse, the more likely we meet the nutrient requirement, because there is no single food that can provide a complete nutrition, a complete nutrient and as recommended. So that's why it's always about food diversity, diverse of food. The second one, the key messages also that similar across country is to limit consumption of less healthy component in diet, specifically sugar, salt, and fat. So in the pyramid, we will see that 3 sugar, salt, and fat at the tip of the pyramid, and it should be consumed in a very limited amount. Okay, now we see whether or not the recommendation are different when we enter the pandemic era. So basically the recommendation are similar, yeah. So because if we practice what have been recommended in the food guide, so it will give us a health. It really support us to be healthy, including to increase our immune system, which become a main concern during pandemic because people want to minimize the risk to get infected by the virus. So the only way is to increase the immune system. So that's why increasing immune system become a main attention, yeah, from most of the people during pandemic. I take this recommendation from the WHO. They also have a lot of infographic for public to have a better understanding what to eat more, what to eat less. But basically, the suggestion, the recommendations are quite similar with the food guide that every country has. They also have additional points, like for example, the point number 1, make a plan, take only what you need, and be aware of portion size. I may say that this may be related to the risk of obesity and overweight during pandemic, because we tend to have a more sedentary life and then eat more. So that's why they have additional point to be aware on the portion size and take only what you need. So we don't have to stockpile more foods than we need. They also say that enjoy family meals and prepare home cooked meals, because so far home cooked meals are considered healthier because we can control the amount of sugar, salt, fat, and also we can use fresh products compared to if we buy food outside. If we talk about balanced nutrition practices, it's not only about food. Yeah, balanced nutrition also include the factor beyond food that will directly influence our nutritional status. In this case, which are very relevant during pandemic, is physical activity. So obesity prevention, for example, it's really about energy balance. So balance between the intake and also the expenditure. So the expenditure is achieved through sufficient physical activity. So that's why the WHO really emphasize us to be active during pandemic. Even if we stay at home, we still be active and do physical activity. If we cannot afford to have rigorous physical activity, we may have moderate, intense physical activity, but it is suggested to do it in regular basis. Even when you do your working from home, so you have to check your sitting posture, and also you have to break up your sitting and stand up and do a very simple stretching while working for 10 minutes, and after several hours, and you repeat again. Okay, now is the nutrition practices during 19 pandemic. Given that recommendation and also the changes during pandemic, so we would like also to know how Southeast Asian practices nutrition during COVID-19. So I take these the ones in the purple table, that COVID-19 really affected people's food choice motive. Food choice motive is people's reason to make decision about what to eat. So before COVID, the first consideration of most people are about taste. And the second one is about price, and health and safety is placed as in the third rank of a priority of people in making decision on what to eat. But post-COVID, the first rank is health and safety, which is good news. And then taste become the second rank, and then price become the third rank. But we should aware also that the survey is done through online. So the respondents is not a general public. Yeah, the respondents are the one who can access internet, and then the one who maybe have more interest towards health and nutrition. So maybe it somehow influenced this the survey, that health and safety become the first rank of the food choice motive. But studies also found, for example, among Malaysian adults, that 41% of the respondents perceived that their eating patterns were healthier, while a less percentage, half of that, consider that their eating patterns become less healthy. And they also, among Thai survey in Thailand, a majority of the respondents, 85%, they reported to have more concern for health, and they start to consider nutrition when they purchase foods. This is also a good news. Before I list down in more details findings of the study about the nutrition practices, I would like to give some notes to make all of us in the same page. First is the data source that I use are published studies, published report, and also market survey from a prominent company. And then second, I really would like to also capture the practices, the more recent practices in 2022, because 2022, it seems that the movement restriction is much less. But unfortunately, the most publications available and accessible refers to the condition in 2020 and 2021. So less about condition in 2022. So then the results later on will be about the practices during lockdown or during conditional movement control order. And also we should be aware that method of the data collections of the studies are mostly online survey via social media or personal network. So it means the generalizations of the findings is less, yeah, because the respondents are mostly those who can access internet, who have more interest towards health. And it turns out that most of the respondents in the online survey in many studies are mostly female, and they have middle high education. So that's why the generalization should be, we should be cautious on the generalization of the findings. In terms of nutritional status, because the nutrition practices at the end determine our nutritional status. So we may then wondering whether or not COVID-19 pandemic have impact to the nutritional status, especially to people in Southeast Asia. Unfortunately, from many reports, both in the regional, the ASEAN Food Nutrition Security Report 2021, or from the UNICEF, the most current information, they say that it is not yet possible to fully quantify the impact of the COVID-19 pandemic into the nutritional status. However, globally, it is estimated that there is an increased prevalence of undernutrition from 8.4% in 2019 into 9.9% in 2021. So the data is based on the projections given the food security and also the food access in the global world. And it is also believed that the pandemic worsened the existing challenges in Asian member states, because even before pandemic, most of the people in Southeast Asia, they already have challenge to access nutritious food, because most of them rely more into carbohydrate source and much less into protein and nutrient dense foods, especially the animal protein and fruits. I put a statement from UNICEF in a box that generally COVID-19 pandemic in Southeast Asia increased reliance on cheaper foods due to reduced income, and also due to a rise in increased reliance on cheaper foods, and also a rise in purchase of packaged food, because it is considered more convenient, especially during the movement control orders. Yeah, a moment, I have problems to move on. I would start again the I think I would need assistance to share screen, Dr. Jin, because it seems
Yes,
that my
Dr.
screen
Aga,
doesn't moving.
okay,
Yeah.
we'll ask our team to
Thank
share
you.
for you.
For a while.
Yes, next slide, please. Yeah. Meal and snacking frequency and the portion size. Studies found that COVID-19 triggers more frequent snacking, more frequent meal due to boredom, staying at home, or in contrary, it triggers less frequent meal due to reduced income. So in both sides. So I take these two quotations from a video posted in the UNICEF website, coming from a variety of groups of community in Southeast Asian country. If we look at the first quotation, it comes from a wet marker vendor, a mother of 2 children in Malaysia. She mentioned that the children are at home. So I think it normal being when they have nothing to do, you tend to eat more. They are hungrier faster. They go to the fridge more often. They try to find snack more often. So that's why it indicates a more frequent snacking and also meal during pandemic, because they stay at home, the kids, so they have less activity to do. While in contrast, from the vegetable seller from the Philippines, she is also a mother to 5 children. She mentioned that they eat twice a day, lunch and dinner. They skip breakfast. They do receive a relief foods from the district and from the mayor, and the food consisted of instant noodles, canned foods, and rice. Next slide, please. Yeah, another impact on the during pandemic. Another impact of COVID-19 pandemic is the increase of home cooking and also food literacy. If you see in the left side, the picture, it's about the consumer preference for where they dine have changed since the pandemic began. So before pandemic, around 50% they like to have dining out, but then it retain, yeah, the 50% retain pre and post COVID, but then 34% switch from dining out into ordering in post COVID. And if we see the quotations, they say that a housewife in Indonesia, I have discovered so many things I enjoy about staying at home. Even after lockdown and then restrictions were lifted, I think my family and I have eaten at home every day for the past several months. So the willingness to improve food literacy skills are also noticed in the study from 190 countries. They highlight the role of home cooking during the pandemic and then the willingness among many people to improve their literacy skills. We also see this phenomena in Thai consumers. 75% of them prefer to cooking at home. And then when they cook at home, they use fruits and vegetables. And in Malaysia, similar findings are observed among adult Malaysia. They reported to have healthier cooking method, which means more diverse and lower in fat, sugar, and energy. So it is a good. While I also would like to emphasize the message in the purple box, whether we can conclude that individuals ate more heavily due to increased home cooking during pandemic. But unfortunately, the studies say maybe it is too early to conclude that, because although the home cooking increasing, but we still have a concern about the unlimited access to less healthy foods currently penetrate a lot of households. Next slide, please. Consumption of variety of foods. These are among infants and under 2 years old. And it seems that dietary diversity among infants and also under 77% infants in Indonesia and 30.3% children under 2 children in the Philippines receive meal meeting criteria of minimum dietary diversity. But we also need to have attention that these two surveys done with a different method. The Indonesia is self-reported online survey, majority highly educated mom, while in the Philippines it was done through phone survey and majority from food insecure family. So that's why we see a quite different figure in terms of minimum dietary diversity among under 2 years old children. They believe that the good diversity somehow is due to mothers now spend more time at home and also cook, so they have time to cook more varied food and receive more frequent support from family in child feeding. Next slide, please. And next issue is about animal source foods, because despite considered as a good source of vitamin, minerals, and also protein in terms of their bioavailability, which is better than plant-based foods. However, the price of animal source food is generally higher than plant source food. So in Myanmar, for example, a woman indeed reported, majority women indeed reported to have less meat and fish due to reduced income during pandemic. But the good news is they are a cash transfer recipient. A group of women who also have nutrition education as a complementary of the cash transfer program, they manage to have better dietary diversity compared to a group of women who only receive cash transfer but without nutrition education. So although it may not prevent fully the declining of the consumption of animal source food, but nutrition education does help to prevent the worst, the declining of the animal source food. Quite interesting statement also come from a student in Thailand. She mentioned that during lockdown, I ate mostly instant noodles and skipped dinner altogether. I now eat more fruits and vegetables, double the amount that I used to because I cannot afford to eat meat. Yeah, so she replaced the animal source to fruits and vegetables, which are considered more affordable. Next slide, please. Fruits and vegetable consumption, we recommend consumption of sufficient fruits and vegetables. However, especially during the lockdowns, because they are perishable foods, so the supply chains was quite heavily disrupted, so it becomes less available, especially during early pandemic. And because mothers tend to prefer to go less often to grocery shopping because they don't want to be in the crowd, so they don't want to go outside the house. So that's why perishable foods like fruits and vegetables become less available at the household level. It is worsen the condition because even before pandemic, when accessibility of fruits and vegetables become less issue, the consumptions of these two food groups also become a concern because many people in Southeast Asia consume much less than the recommended amounts of fruit and vegetable. So the impact of pandemic is considered worsen the situations, which it's also a finding from a study in Malaysia, in Indonesia, and also in Thailand. And yeah, among university students or among general adults in Malaysia. Next. Sweet foods or sweet drinks, salty foods, and fatty foods. As I previously mentioned that in the food guide recommendation, actually the consumption of these three components, sugary, salty, and fatty foods, we have to limit the consumption of these three components. However, the study findings share that the consumptions in general increase because these three foods are considered as a comfort foods because COVID-19 pandemic really bring many people into boredom because we have to stay at home and we don't know until when, and also put the anxiety. So in most cases, the consumption increase. So actually, it is not good, yeah, from the point of view of what is considered as a healthy diet. I also would like to highlight the ones down there, the one with the sunrise. Children have witnessed more ads for unhealthy products, including sugary and sweet foods during pandemic. So it is exposure because children stay at home, they watch TV more often, also social media, they are really into that. And there are a lot of ads in social media and TV about sugary drinks and salty foods and fatty foods. Next slide, please. Instant foods, similar to the the case for the sugary, salty, and fat food, we are recommended to have fresh foods, not instant foods. However, the sales are increased, about the instant foods rose up to 52% Thailand and also in the Philippines, in the Vietnam. Because during pandemic, instant foods are considered reliable and often inexpensive and have a longer shelf life. This is as Indonesian housewives share. Prior to COVID, we can stock up daily needs for a month, but we cannot do it now. For example, we consume more instant noodles now, particularly us, the parents, but not the children. But it indicates that instant noodles are more preferred. Maybe not, we cannot say preferred, because that's the options that is that fit the conditions of most people, so they prefer to have. Then they choose instant food. A Filipino fruit seller also said that sometimes we eat canned food, but it doesn't offer much nutrition. If my earnings are enough, I buy fish and vegetable. So they know basically that instant noodles actually is not recommended, but the condition pushed them to consume more instant food during pandemic. Next slide, please. I believe I still have 3 more slides. Now it's about the fluid intake, because one study in Indonesia among adult workers done in April 2021 during movement control order. So a lot of people work from home. The study was done through online, self-reported using 7-day fluid record. So the results show that more than half of the subjects have inadequate fluid intake, and the intake is lower than other study done before pandemic. And the diversity of the working scheme, 100% work from home or hybrid from home and from office or 100% from office, it turns out that the fluid intake is not significantly different. However, the workers who do the work 100% from home, the study found that they consume the least water, but the highest sweetened beverages. So while these are the rationale explained by the authors why the workers who do 100% work from home have a less water intake, because they may feel less thirsty because they stay at home with the air-conditioned room or comfortable circumstances, and then more sedentary, so they feel less thirsty. Or why they drink more sweetened beverages, because they feel bored, to stay at home 100%. So maybe SSB is considered as a comfort food for fun, to kill the time and also to reduce the boredom. Next slide, please. Next is about the physical activity and gaining weight. It become concern because the prevalence of obesity and people gaining weight, although it may not necessarily into obesity, they are not necessarily considered as obese, do not belong to the obese, but gaining weight, a lot of people gaining weight, also an alarm for every of us, because obesity is a main cause of many non-communicable disease. Indeed, the study find that among university students in Malaysia and also in Indonesia, a lot of a quite high prevalence reported to gain weight, with a median weight gain of 2 kilograms and have more sedentary, more than 8 hours per day. I would like to also emphasize the information in the box that people who work from home do consume more homemade meals, which are considered healthier. However, they also snack more frequently. It is healthier, but if you do it too much, in much higher frequently than you need, then the risk to gain weight will always be there. And because staying at home, maybe it is comfortable because they have easy access to food at home. Next slide, please. Yeah, this is a global study about the weight gain. We see some of Southeast Asian countries are there in the figure. Said globally, 20% adult reported losing weight since the COVID-19, while many more, 31% reported gaining weight. And then 27% reported to do more exercise, and about similar proportion reported to have less exercise. Next slide. This is the last slide. I would like to highlight some suggestions proposed by some studies. They propose that government have integrated national public health policy, and also we should do a more innovative delivery on nutrition service to community, especially in rural area and in where the information access is much less compared to the urban area. And then we have to do strong advocacy for online food ordering platform. They have to also contribute to promote healthy diets. And then development of health portal and mobile applications, so it enables people to access useful tips and information. I see that in Singapore there is such portals, Stay Well to Stay Strong, so everyone can access this through mobile application to get tips and information. Thank you. Next slide. I think this is, yes. Thank you very much for the attention. I will give the screen back to Dr. Jin. Thank you.
Thank you, Dr. Ade, for providing us with a picture of how the COVID-19 pandemic prompted food insecurity, especially due to mobility restrictions, sudden change or sudden decrease or limitations in household incomes, and increases in food prices. So indeed, food choices have been affected, resulting to changes in nutritional status. So thank you for emphasizing the importance of food literacy and proper nutrition practices, including movement and exercise, which households may find useful during disruptions. And of course, outside our own communities, we really do hope that studies like REC-1s will serve as a call to action for governments to improve or update public health policies and health and nutrition services. Thank you, Dr. Ade. So again, may I remind our online attendees watching the webinar via Facebook Live, please start typing your questions in the comments section, including your location or country of origin. If you are tuned in via Zoom, please post your questions in the Q&A box, which you will find in the menu bar of your screen. While waiting for the next presentation to be shared on screen, please allow me to tell you more about our second speaker this morning. So earlier, one of the things Dr. Ade touched on when it comes to nutrition practices during the pandemic was access to food and which kinds. So we have next Assistant Professor Joseph Adriel de Guzman, who will discuss how this access is affected by social, economic concerns, cultural beliefs and practices, which are factors that led to the changing patterns on food and nutrition because of the pandemic. Assistant Professor Joseph Adriel Jad de Guzman is from the Department of Anthropology of the University of the Philippines, Diliman. He finished his master's degree in anthropology from the same university, where he studied the experiences of Filipino migrants in Hong Kong through the lens of the food that they ate. He is interested in studying the links between culture and food choice and consumption and how it can be used to address issues regarding food security and nutrition. In addition, his other research interests are in migration, archaeology, and material cultural studies. Let us all welcome Assistant Professor Jack.
Hi, good morning, everyone. Thank you for the introduction. Let me just share my screen.
Sir, your voice is a little mahina.
Hello, hello. Hello, ano ba? Is it clear now, Ma'am Jean?
Not exactly, sir. Not yet.
Hello? Hello? Wait.
Okay, sir. Okay na po, sir.
No, okay na. Hello? Better? Hello?
Go ahead, sir.
All right. Thank you. So, good morning, everyone. Again, thank you for the introduction. So, my discussion for today will focus around cooking, cuisine, and COVID. So changing patterns on food and nutrition as a result of the COVID-19 pandemic. So I think Dr. Wiradiani's lecture earlier really gave a good backdrop to what I'm going to discuss, because I'm not really going to focus more on the data per se on what have we found in terms of food consumption patterns and habits, but rather how we can look at this anthropologically and how we can see the impact that culture has on something like food security and nutrition. Which brings me to the my first question, or really the question that I'm going to try to answer today in this short discussion is, how does culture affect food security and nutrition? When trying to answer this question, I always try to look at this particular concept called the omnivore's dilemma. So the omnivore's dilemma was coined by Paul Rozin in 1976, popularized by Michael Pollan in his book entitled The Omnivore's Dilemma. So what is it? It comes from Rosan's study in which he looked at the eating patterns of different kinds of animals. And the omnivore's dilemma basically describes the challenges that animals who consume a wide variety of food, also known as omnivores, have. Meaning to say, if you can eat most things, how do you decide what to eat? Because, for example, if you're a cow, it's easy to decide what to eat. You need to eat grass, for example. But if you can eat a wide variety, how do you decide which foods to eat? One could argue that for humans, food culture is our answer to the omnivore's dilemma. So instead of each and every generation trying to figure out what is and what isn't food, we've developed cultural practices that we pass down through each generation that serves as a guide on what is good to eat. So in other words, cultural conceptions on food can influence choice and consumption, which in turn influence food security and nutrition. Now, this has been explored in anthropology in a lot of different ways. I'm just going to provide four examples of this. So first, we have Margaret Mead's study on how the abundance of food in American society can relate to conceptions of obesity and health, because food is very widely available. How does it change how people conceive obesity more as a personal failure or your inability to control what you eat, for example, in that particular cultural context? Or we have Bourdieu's study on how social class can influence how we have certain preferences in flavors and diets. In this particular study, he looked at how the working class laborers tended to prefer foods with much more stronger tastes and foods that would satisfy them more. In other words, they would feel full very quickly, whereas people from the upper classes tended to prefer lighter tasting foods. Then we also have Sidney Mitz, who in this book, Sweetness and Power, looked at how the demand for a food item such as sugar can influence huge things like global economics and politics. And then another study that I also like to point at is Jose Ciro Martinez and Brent Eng's article on how bread was a key factor in the wartime strategies during the Syrian civil war, in which sides would often target bakeries because they believe that controlling the hunger of a particular group was one of the easiest ways in trying to conquer that particular group. So we see here that food and culture is very much tied together, and it affects things like food security and nutrition. Which brings me to my next question, the more specific question of how this pandemic has affected cultural beliefs and practices related to food. So Dr. Redniani had already provided us with a background of the pandemic, so I've opted not to discuss it in further. Also for the same reason that at this point, the realities of living through this pandemic are pretty much evident to all of us, I believe, even though we experience it in different ways. So with that, I also think that before I go into the details of how food cultures have developed during the pandemic, it's important to remember that, like other aspects of society, the pandemic has affected people in very different from different socioeconomic classes in very different ways. So like the saying goes, we're in the same storm, but we're in different boats. So with that in mind, how do these experiences differ and why are these experiences important? So the first thing that I'd like to go into is the notion or the concept of ayuda. So ayuda is the government's response to the early challenges of food insecurity brought upon by the limited mobility because of the pandemic or the measures that we took to control the spread of it. Ayuda can be looked at in different ways. There's this one study by Ruiz Tafoya who considered ayuda as an instrument of tension management in Metro Manila. So he argued that because ayuda was deployed in the early weeks of the pandemic, it could have been the reason why the Philippines, compared to other countries like Mexico, he was doing a comparative study, the Philippines did not see like widespread panic buying or looting, which was prevalent in countries like Mexico during the start of the pandemic. So for him, he considered ayuda as a way of addressing the tension brought upon by concerns in food security. But as you can see here, I have here some photos grabbed from Facebook of different people sharing the different ayudas that they got from different city governments. And really what I want to pinpoint in these pictures is what are the types of food that are given or available in these ayuda packages. So if we see here that the ayuda packages are mostly made up of processed food stuff, which is understandable because these types of food tend to last longer and it's easier to distribute. But we have to also consider how does it affect nutrition because we all know that processed and preserved food tend to have higher levels of sodium, for example, and generally tend to be less healthy than fresh food. So with that in mind, with ayuda, how did the phenomenon of ayuda influence cuisine, influence food culture in the Philippines? One thing that I noticed was people became very creative in trying to transform their ayuda from just canned goods, from instant noodles into dishes. So you can see here, this person shared a recipe for low budget tuna pasta with ingredients coming from the ayuda packages. And this one, he attempted to quote them, level up their ayuda and turned them into a Spanish sardines pasta. And then we have a recipe here for sweet and sour ayuda bowl. So they're referring to the ayuda because the ingredients used in these dishes all come from the ayuda packages. So here we see how people can be creative despite the limitations placed upon them in terms of food choice. And this is also an indication that when it comes to food and food cultures, how it's prepared is just as important as what is being prepared. So the mere act of preparing food differently can also improve its palatability and transform ingredients into something else. And for some, maybe help you forget that you are eating ayuda and you're eating something else. Aside from ayuda, we also look at the community pantry. So it's another phenomenon that developed during the quarantine. So according to Gozum, community pantries helped address the insufficient government response to food insecurity during the hard lockdowns of 2020. In these pictures, I'd like to compare the types of food available at community pantries to that of ayuda. Although, as we see here, there's sometimes you also have community pantries that also have some processed foods. But for the most part, like in these two shots, we see that there's a lot of fresh fruits and vegetables, eggs, and so on. So one thing that we have to remember is we have to consider who is supplying the community pantry. These were usually volunteer-driven efforts to taken as the motto of the community pantries were taken from those who have extra to spare. So we see how important it is to consider the type and the quality of food being distributed among communities, whether it's in aid, as in the case of community pantries, or in market economy, such as in the case of farmers markets and local wet and dry markets. On a more personal experience, during my time in Los Baños during the pandemic, I noticed a lot of small-scale fruit and vegetable stands pop up in different street corners. Whereas before, if I wanted fruits and vegetables, I had to go to the grocery or to the wet market. During the pandemic, just a few blocks from my house, this small vegetable store started popping up, household managed grocery stores, because of the need or the demand for fresh vegetables. And then, aside from community pantries and ayuda, there's another intervention to address the lack of government action on food security. And this is the rise of household and community gardens. So, according to Kampman, there was a remarkable increase in the interest and in community and home gardening, particularly in the Philippines. Culturally, this is indicated by the entry of the terms plantito and plantita in the cultural lexicon. So we became much more aware of the idea, or welcome to the idea of raising plants even within our homes, even in condominiums, for example. And I think this is also perhaps spurred by anxieties brought upon the challenges to food security, brought upon the pandemic, because some individuals initially had some difficulties getting fresh fruit and vegetables. So some households took it upon themselves to develop their own means of achieving food security by growing their own food. So like this individual here, who was able to harvest a lot of food for their own meals. Now, with all these being said, we have the ayudas, we have the community pantries, and then we have household and community gardens all propping up, all measures to address the challenges to food access and food security brought upon by the pandemic. Even if you have these fresh produce, it is useless if you lack the skills to prepare them into full and proper meals. So another side of this changing patterns in food and culture brought upon by the pandemic is the rediscovery of the kitchen. So for example, according to one ABS-CBN News article, the following food items trended or became popular during the pandemic lockdown. So sourdough bread, Korean garlic buns, home-brewed coffee, ube cheese pandesal, sushi bake, burnt Basque cheesecake, pancake cereal, feta cheese, baked pasta, and dalgona coffee. So eventually, because of their popularity, they would be available, they would be sold online. But initially, these became popular as cooking challenges on sites like TikTok. So what's interesting about all of these food is that they can easily be created in the kitchen as long as you have the right ingredients. So one of the first one was the dalgona coffee, and I remember that really what you needed from here was just instant coffee, and you just had to whip it for a long time in order to get that thick, fluffy texture of the dalgona coffee. So what I'm saying here is all of these became popular because people were trying to recreate them, and in the process, they also became reacquainted with their kitchens and the art of cooking. According to a 2016 study by Saloma and Akpedono, they conducted a study on the changing food consumption practices in Metro Manila condominiums back in 2016 before the pandemic. While condominium households did cook at home, these tended to be families with hired domestic helpers. And when they cooked at home, there were certain considerations that affected this decision to cook, such as the space limitations because condominiums can have small kitchens, or the lingering smells because of the limited airflow. So they noted that households tended to eat out more instead of cooking. So in essence, before the pandemic, there was this decline in cooking at home and a preference for eating outdoors. But the pandemic, which forced the people to quarantine in their homes, may have also led to people to rediscover their kitchens and the joy of cooking. Another evidence of this may be the popularity of cooking implements like air fryers. So perhaps you can also link this to the idea that people started looking for healthier means of cooking as well. However, like what Dr. Wirajani mentioned earlier, home cooking doesn't automatically imply healthier cooking, right? But the ease of accessing tutorials for cooking these dishes as well as other dishes may have facilitated the interest in home cooking. So now it's easy to search for tutorials in YouTube or tutorials in TikTok when it comes to how to prepare these dishes. So while before the pandemic, it would have been difficult for people, especially young single workers, to find the time to cook at home because they are at home, because they have nothing else to do, and because these cooking challenges pop up along social media. It's driven them to be able to rediscover the kitchen, rediscover cooking, and develop skills on how to prepare new types of food. And with this also comes the, again, being in the context of a pandemic, the increased health and nutrition awareness. So even before the pandemic, a survey on 750 Filipinos showed that Filipinos are conscious of their health due to an awareness of how illnesses can severely impact one's financial status. But then a survey conducted by Manulife during the pandemic showed that 99% of the respondents said that they took action such as regularly exercising or improving their diet to manage COVID-19. So there's this increased awareness in health and nutrition, which translates as well um, with the preparation of food. So this is very similar to what Dr. Wiradiani shared with the Malay and Thai populations, but of course, this may need more empirical data. Perhaps all of this ties with the previous observations. So because of a heightened awareness on the impact of diet on one's health, people embraced fresh produce over processed food whenever possible. They built and tended community and household gardens and took it upon themselves to learn how to prepare food on their own. In a way, taking back their sovereignty over what they eat and how they eat it, giving more agency to themselves on how they are able to prepare their food. So the question now is, moving forward, knowing all of this, how will these emerging cultural practices on food affect food security and nutrition? According to a study done by Angeles Agdeba, also cited by Dr. Wiradiani earlier, around 2/3 of the households surveyed during the COVID pandemic experienced moderate to severe food insecurity during the lockdowns. And poor households tended to be likely more moderately to severely food insecure compared to middle income households. So as these news articles show, it could be argued that the pandemic showed that the key problem we face in terms of food security is not necessarily a lack of food, but the challenges in the distribution of food. So in other words, it's not a problem of supply, but rather than that of access. And we also see from the examples I showed earlier that people, when driven to do so, will also develop means to have individual food security. But of course, these interventions will have more significant impacts if they can be scaled at larger levels. There are already many studies that show how urban community gardens can help address the problem of urban food deserts or the lack of nutritionally of nutritional foods in urban areas. So the problem of urban food deserts in America. So we need to look into ways on how we can empower and support the development of community gardens both in urban and rural communities. Aside from providing an alternative means of establishing food security, these gardens also provide the community with the opportunity, as I mentioned earlier, to take back their decisions on what they get to eat by allowing them to a place to grow their own chosen food. So just to sum up very quickly, as we've seen, the pandemic has resulted in significant changes in cultural practices related to food in the Philippines. However, these changes did not spontaneously develop on their own, but are influenced by factors such as the availability of food. And of course, culture is an important consideration in developing and implementing interventions to address concerns in food security and nutrition. As a final example, for my last point, I'd like to present these posts that I saw on Facebook for rabbit meat. During the pandemic, I found that there was a small but significant interest in rabbit farming and selling rabbit meat. So these were attempts to help popularize rabbit meat through the development of farming seminars and workshops or through food fairs showcasing different rabbit meat dishes. So the push for this is because rabbit meat is said to address the need for alternative protein sources. But of course, any attempt to introduce it to the public should be tempered with an awareness on how culture affects perception of certain foods. So one of the frameworks that I often go to is one by Lucy Long, and she calls it the realms of culinary experience. So according to this model, all food as viewed by a particular culture exists on a spectrum of two dimensions. So one is being edible or palatable, and then inedible and palatable. Then the other is exotic or familiar. So a food item can be exotic and edible, but it can also be inedible and familiar. So an example is the ayuda recipes I showed earlier. So going back to the rabbit meat. For Filipinos, rabbit meat might be something that they consider exotic, maybe even inedible. But by making interventions such as preparing rabbit meat in a familiar manner, as you can see in the photos here, lechon rabbit and adobo rabbit. So by preparing them in dishes that are familiar to Filipinos, like lechon and adobo, you can move the perception of rabbit meat from a place that's exotic to inedible to some place more familiar and therefore maybe much more edible. Now, my point here is this, and this is where rabbit meat advocates are really doing for the most part. Even if you're able to make all the scientific and rational arguments for a food item such as rabbit meat, oh, it's a good source of protein, oh, it's much more sustainable to raise, and so on. At the end of the day, culture, which going back to the start of my talk, humanity's answer to the omnivore's dilemma, is still really going to be the final arbiter of whether or not something is considered food by the majority, by the cultural population, which is why it's always important to consider the cultural component when dealing with issues on food security and nutrition. So thank you very much. That was just a very short discussion on how culture factors in the process of considering things like nutrition and food security. And there, I hope that was helpful for everyone. Thank you.
Okay, thank you, Assistant Professor Jad, for your presentation, The Omnivore's Dilemma in the Time of Pandemic. It is good to hear the emerging beliefs and practices on the importance of maintaining good health and nutrition, more so when the pandemic hit. What struck most was your emphasis on the socio-economic class differences, which pose how inequality has further worsened the effects of the pandemic food and nutrition security. The community pantry movement that went around the Philippines at the height of the pandemic, along with household and community gardens, are good examples that illustrated people's ingenuity to find means for food. Although you and Dr. Ade did point out, food access is the main issue. An interesting note that I made was your slide on the realms of culinary experience, which shows how culture is indeed an influential factor on establishing sustainable food security and nutrition, as is the case of rabbit meat being palatable or not. Okay, with that, let us now move on to the open forum. I'd like to invite both our speakers to kindly please open your cameras for our open forum. I have several questions here lined up. Maybe I will start with Dr. Ade. I have here 3 questions that are sort of related to each other. So for Dr. Ade first, and then I'll ask Professor Jad to address it as well. First would be, we all know how COVID-19 decimated jobs and threatened food security and nutrition of millions of women and men, especially in low-income countries, including small-scale farmers and indigenous peoples. Can you share with us some of the best practices that the government of Indonesia implemented to address these food security and malnutrition challenges during the lockdowns? Dr. Ade.
Yep, thank you very much for the questions. I'm sorry, I have to turn off my camera. I got notification of the unstable internet connections. Yes, even before the pandemic, ensuring that everyone get nutritious foods and also safe foods to fulfill the basic needs, especially, is already challenging. Yeah, because you ask questions about Indonesia, given the very large and huge number of populations. If I may recall that Indonesia, for the middle low, especially the second lowest group of community, which have less resources, considered as a low economic family, the Indonesian government have assistance in terms of conditional cash transfer to the considered as poor. We at national level, we have a database and also the national criteria, who are categorized as poor and those eligible to get the cash transfer. But of course, the challenging is always there, because it is called as conditional, but the monitoring whether or not the family, the recipient family really do the requirement, because they, for example, in the family who have a pregnant woman, they are eligible to receive some amount of money because they have pregnant woman in the household. If they, at the same time they also have under 5 children, so the cash will be add up. So the amount of the money will be much higher. However, in order to be a recipient of this program, they should fulfill some criteria. So that's why it is called conditional. For example, they have to go for minimally 4 times of antenatal care. The children have to be fully immunized and get breastfeeding exclusively. But the monitoring of these conditions need a lot of improvement. So especially during this pandemic, so but the cash transfer really one of the key national program, especially for the poor during the pandemic. And also the government, especially the Ministry of Agriculture, they try so much to cut the long supply chain, because at the moment the supply chains from the producer to the consumer goes into a lot of level with a lot of actors. So the lockdown really impact, especially among urban poor people, because they really rely food by buying. Yeah, they cannot produce their own food. They don't have space to grow any foods in urban poor, and they rely on the daily income. So then the supply chains, like a mobile pop-up, a mobile market, so that bring closer the market to the community, is one of the innovations, but it is not done at national level. It is in some districts, it is really a local initiative. And it is also quite common. Study also found that during pandemic, a growing sense of solidarity among the better off family to help a less resources family is growing up quite high during pandemic. So some informal community groups, community organization, they organize some like food aids or food donations to less resources family, because that's one of positive impact of COVID-19 pandemic. It grow the sense of solidarity between us. So, but again, it is not a national regulation. It's not a national program, but it is more into local initiative, both formally by local government or informally by some of the informal community organizations.
Thank you, Dr. Ade. I think that was also part of what Professor Jad illustrated earlier, right, sir? Like the supply chain was also disrupted here. It's not exactly the lack of food, but more of like the access to food. And also we have informal community groups where also the setup is like the community pantry. But sir, would you know if like we have conditional cash transfer programs as well, like the social amelioration program, was it also conditional? I have to check. But for our colleague, whoever asked it, in the Philippines, we did have that program as well, providing that kind of aid. My next question, a little related to that, is that there is a stark difference in food choices, right? Because of the inequality. But would you recognize that there is also that difference when it comes to like the geography? Like for Indonesia, for Dr. Ade, is there a stark difference between Philippines and Indonesia? Or for Professor Jad, would you say there is a stark difference between Metro Manila and say Laguna, or amongst the main islands? So maybe Prof. Jad first and then Dr. Ade.
Hi, thank you. Yeah, I think there is a big difference when it comes to not really a big difference, but there might be differences in terms of when you're looking at very urbanized areas versus rural areas. Maybe for example, top of my head, if you go to like coastal communities, then maybe there's a much more larger dependence in fishing or in seafood in the diet, for example, or as opposed to when you go to somewhere in Laguna or Los Baños, or when you go to Metro Manila. With Metro Manila, I think the biggest factor may be a wider variety in terms of diets, because since you're in the city, you're exposed to not just a traditional Filipino cuisine, but you're also exposed to other types of cuisine. So um, the impetus to make other dishes is there. Whereas maybe in rural communities, it's much more the traditional methods of cooking. But of course, they're also exposed to it through like social media and the internet. So it's possible that they also have that variety. Maybe one factor I just remembered when I was in Los Baños for the lockdown, there was a time that I think it was the local government who did this. One of the food that was distributed as part of Ayuda were live chickens. So I would see people walking down the street holding live chickens. So that really struck me as a person who grew up in in Metro Manila. I wouldn't know what to do with those live chickens, for example. So I think that highlights maybe the differences, but there are certainly differences.
Thank you, sir. Dr. Ade, on a regional perspective?
The question is about the food choice motive, whether or not there are
Yes.
differences across. Yes.
Yes, very, very stark.
Yes, the study about food choice motive become, I mean, I for example, I have the students in Universitas Indonesia. Some of them, they do their dissertations and also thesis about food choice motive, because we cannot assume that people have a similar motive. So when we do nutrition education, we do it in blanket. We assume that everyone will think this is important for them, while the fact it's not true. Everyone have their own motive. So if the education doesn't fit to their motive, so I mean, it will not be optimal, because they don't think I need that because it doesn't fit to their motive. So far, by study, among the 9 main food choice motive, it seems that the most important one is the taste, cost, and nutrition, and also convenience. And if we see a segment, if we segment the community or the people, for example, based on their economic conditions, for the better off family, maybe, yeah, cost will not their motive, because they don't really have problem in terms of purchasing power. So they, for example, they're more into taste, they're more into mood, because one of the motive is mood, and it's growing during the pandemic, because they feel bored, or they look at the social media, so they know some food may is preferred by everyone, so it killed the boredom. So it's based on the mood. For the better off people, maybe taste and mood, and some who already have a good health and nutrition awareness, nutrition become their motive. But for the less fortunate family, less resources family, yeah, maybe cost is really their motive. Yeah, they know that a certain food is more nutritious for their kids, for example, but because they cannot afford that, then they try to be realistic, so the cost will be the top of their motive when they make decision in choosing what they need, what they want to buy, and what they want to give to the children. So the differences of the motive indeed influenced by, for example, by economic factor, and also urban and rural, because in urban they get a quiet, easy access toward information. So while in rural, information is not that easily to be accessed. So it's also create and shape the food choice motive of people in urban and rural.
All right, thank you, Dr. Ade. And in relation to food choice motives, I have here a question from Billy Tang from Malaysia. This is for both of you. Most households have dwindled to Maslow's hierarchy of needs. So how can we make safe and nutritious food accessible to vulnerable groups, which should be human right? Quite a difficult question. Maybe I'll ask Prof. Jad first and then Dr. Ade again. Yes, sir.
Okay, thank you. First off, I agree that it should be human right. From the examples that I've shown earlier, I think my biggest recommendation might be what I've observed during how government interventions were handled during the pandemic is it became very confusing because the national government had its own, and then the local government had its own, and then even the barangay level had its own. So sometimes they would clash with each other. And we see that through the example of the community pantries, communities themselves really have the drive to help each other out in situations like this. So what I think is a good way of addressing these challenges in making safe nutritious food accessible is by adopting maybe a bottom-up approach. So by working with communities and listening to them what their needs are and how they think these needs can be met. So I think that's one thing I will advocate for. So being much more in contact with the communities and adopting maybe a bottom-up approach in trying to address this problem.
Thank you, Prof. Dr. Ade?
Yes, this is a tough question and also a concern of everyone, I guess. So I agree with Dr. Joseph that a bottom-up approach will also create like a movement, a big movement, both at national level or at the global level, and community always have innovations or creative thinking that we may not necessarily think about it. But for the case of Indonesia, for example, and if we use the setting of school as a setting where we want to invest a healthier practice among school children, for example, engaging teachers, students, and parents to do something to create a better access towards healthier food, for example, in rural area where the access is less and considered vulnerable. But for Indonesian case, a bottom-up should be complemented by regulations coming from the authority, because given the load and also the tight schedule, and then academic indicator, and so on and so on. So if the movement only from the bottom up, sometimes it is less feasible, but the result will be much better if the bottom up innovations is complemented with necessary regulations coming from, for example, district education office, if the case is in the school setting, like I mentioned before. Like what happened now during the face-to-face learning in Indonesia, there is a regulations that the schools are allowed to do face-to-face, but there are some requirements that they have to follow. Some of them something to do with nutrition. For example, the child should have breakfast before go to school. So the child have to bring food from home. So that kind of regulations, maybe at the start, the students and parents feel forced to do that because that's a requirement, that's a regulation. But along the way, it may become a habit, so a good habit. So it's always a bottom up and the necessary regulation coming from the relevant authority.
All right. Thank you, Dr. Ade. I have here a next question for you from Facebook, from SciFood or Maisim. During the COVID-19 pandemic, we separate eating at the house. I think the problem with food consumption is the oldest and the children. What is your recommendation for recovering them? I think the question is not just about allocation of food between the older and younger children, but also on the types of food. So what's your take, Dr. Ade?
I'm not sure I quite understand the question, Dr. Jean. Can you repeat?
I think what our colleague is asking is what would be your recommendation when it comes to selecting food on selecting the type of food for the young members of the household versus those who are the elder ones, which will actually lead me to the next section of my question, which would be about child health and nutrition. So do you have some insights on this?
Yeah, if we refer to the recommendations, whether there are different recommendations for a younger group of people and then the older group of people, yes, in terms of recommended dietary allowance, it is different because it is based on age and also sex. So if they are different in terms of age, so their requirements is also different because the requirement is different. So the practices, the messages conveyed to them, including the food selections, will also be different. But if we refer to, if the younger community, younger household member refers to under 5 years old children, we do have a specific guideline for them because it requires a gradual increase in terms of the amount and also the type and also the texture. Under 5 children is the time when we really need to build their feeding skill, because it's not only about whether or not we fulfill the nutrient requirement, because if it is the case, we may give them a lot of, for example, fortified biscuits, fortified milk, or many fortified baby baby instant porridge. They put a lot of fortified nutrients in the nutrition packs, if you may see. But it's not only about meeting the nutrient requirement, but also building a feeding skill. So later, they will not be a picky eater. So as early as possible, usually after 1 year old, they should be introduced with a variety of food groups. So if we back to the general recommendations of what healthy food is, it always something to do with diversity, because the more diverse, the more likely you will fulfill the nutrient requirement. Even like in the food pyramid that I have shown you, owned by almost all Southeast Asia countries, they make a level of food by the food groups. At the base is carbohydrate source food, and the next level is fruits and vegetables, and the next is animal and plant protein, and the last one, the thing that we should limit the consumption, the sugar, salty, and fat. Even with one food group, there should be a variety of food item, like staple food. We should introduce not only rice but also corn, potatoes, sweet cassava, and for vegetables or spinach. And so the key is a variety of foods for any age, but of course for the younger household members, we should also consider to introduce it gradually, because they have a different stage of building their feeding skill. I think that's all, Dr. Jane. Thank you.
Thank you, Dr. Ade. So to our colleague Saifu, I think what Dr. Ade was saying is there has to be a diverse food options, and it depends, different nutritional requirements depending on age group, sex, etc. Okay, which leads me to the next part of our Q&A. Let us try to put a spotlight on the effects of the pandemic on maternal and child health. So, Dr. Ade, when the pandemic hit, what were the observations of RECFON, and how did you see did governments or communities address this issue, ensuring that there is proper maternal and child health?
Yeah, so what I can share is the experience of RECFON with its two flagship program. The first one is Nutrition Goes to School, aiming to elementary school children until high school children, and the other one is the under 5 children and prenatal. From our observations in our among our school partners, and also some of the practices in the early childhood educations institutions like kindergarten or even playgroups. So the pandemic really changed, especially during the early pandemic, because everyone changed their priority. So in terms of what to buy and also what to do, of course, food and meal is always there because it's a basic need. However, their priority may not necessarily to really achieve the ideal nutritious food like before pandemic. So then maybe their priority change into because they are not sure, especially those who rely on irregular job or daily income family who rely on daily income family. So they may think to save money rather than to buy for example, fruits, because in Indonesia, fruits is generally seen as food groups that is bought if you have extra money. So if you have money, the first thought is staple, and then disease, vegetables. But fruits, if you have extra money, then it's time to buy fruits. So maybe during what we see during pandemic, so because the priority changed, especially those in the middle low income family, so then the diversity of the meal is impacted, but they try to carry on, and the nutrition education at the school level also idle for a while, because the schools really have to adjust all the activity into adjusting from face to face into online. So it's already consumed a lot of energy of the schools and also the regulator. So for a while, for several months during the early pandemic, nutrition educations become idle, and the result is as reported by the nutrition team in each school, the practice of the students really, they do change the practice. They try now, sometimes they skip breakfast. Before pandemic, they have quite more regular breakfast, but during online learning, because they stay at home, they have no fixed schedule. So then the habit of breakfast, for example, now become less regular, because the teacher also have less time to convey nutrition messages, because the school hours is shorter during pandemic. So the priority, again, it's about the priority. The priority is more into adjusting the learning from the face-to-face into the online. However, starting from end of 2021, we should say that the nutrition educations, the activity to rebuild the good habit among the students, among the parents of young children have started, and hopefully we can hear a good news coming from the field, that the nutrition practices among this target group is back to or even more than the practice before pandemic.
Thank you, Dr. Ade. Prof. Jad, would you know if, like in the Philippines, have you encountered similar observations that we've had on maternal and child health care during the time of the pandemic when it comes to food and nutrition security?
Actually, since I haven't done much research in that particular area, I really can't do any specifics. Siguro from my observations, I would say that the challenge comes mostly from, since students are staying at home. So a bulk of because before in some cases, the most of the meals that students have during the day would be just school, outside of school, or but now, since they're all at home, all the food, all the snacks have to be taken care of by the parents. So maybe in that particular aspect, but more specifics, I can't really provide additional information or insights.
All right, that's okay. Thank you, Professor Jad. I have one last question for the both of you, a little tough as well, but you might be able to provide insights. So the news today tells us of a looming food crisis. In fact, The Economist coined it as the coming food catastrophe. So how do you think will we fare when it hits our region, the Philippines or the Southeast Asian region? Maybe Prof. Jad first and then Dr. Ade. Do you think we're ready, sir? After the 2 years of the pandemic, rising food prices, and now a looming food crisis?
I have to be honest, I'm a bit pessimistic with regards to how we're going to approach it. But what I will say is, from what I've seen with how the people, not taking the government aside for a moment, but the people, how they've responded to the challenges of the pandemic, as I've shown earlier um, in my presentation with the community pantries and everything. I'm optimistic in that side that I know that when a crisis does happen, the people will be willing to and chalk it up to the spirit of maybe bayanihan that's ingrained in the culture, but they're ready to step up. I guess what the challenge for the government institutions is to utilize that, to make use of that spirit in terms of addressing possible crisis. So yeah, that's my answer for that.
Thank you, Prof. Jad. Dr. Ade?
So the questions is, are we more ready now, given the 2 years of experiences since March 2020? Maybe I would say that for some group of community, they are more ready because they have done adaptations, and then they know there are some options that they have in terms of source of foods. They can now rely on many source of foods, and they have a lot of options of information source about food and nutrition, and also about health. But for some other groups, they may be still less ready. Yeah, again, economic really matters about the readiness of us, everyone, to face the crisis, especially as big as a pandemic that limit our movement. Yeah, we cannot go outside to look for a job. So for some group, if I would say that maybe they remain less ready compared to the other groups. So that's why for these less ready groups, they need more assistance, either from the government, because government also, I see that a lot of regulations, additional regulations have been launched to face the pandemic. Hopefully some of them really, because they want to have a better approach in case the pandemic has not yet over for some years, hopefully not. But yeah, that's what I can say, Dr. Jen. Some group, I think, more ready, given the lessons learned, the adaptation they do for the past 2 years, but some other group maybe, yeah, remain less ready. So they need more assistance from everyone, especially from the government. Thank you.
Thank you, Dr. Ade. So that sums up our open forum. Thank you, Dr. Ade and Professor Jad, for that very insightful discussion on people's behavior and food and nutrition practices during and post-COVID-19 pandemic. And just like myself, I am sure our viewers today have learned so much and perhaps have been inspired, if not challenged, as we understand that this can be quite difficult for some, to make the move towards healthier and more sustainable food sources and options. So before we close this webinar, I request our speakers for some quick closing or takeaway message. Professor Jad first, and then Dr. Ade.
My own personal takeaways after listening to Dr. Ade as well is that while we know on some level the impact that the pandemic has had on food practices, food security, and nutrition, the challenge there is still to conduct more research so we can know more about really what the impact is, the extent of the impact, and moving forward what we can do. So really that's my takeaway at that. I've gotten a lot of insight, maybe ideas on how to do future studies moving forward from this panel, and I'd like to thank CIRCA for that opportunity, and I extend that challenge as well to others who may be watching to really help in building the knowledge gap that exists in what extent has the pandemic done to affect food security and nutrition. Thank you.
Thank you, Prof. Jad. Dr. Ade?
Yeah, my key takeaways. Yeah, I would like to refer a message posted in one of the is posted by a personal blogger, yeah, which I agree so much. She mentioned that COVID-19 is a wake-up call for all. So it has given us a moment to pause and also to reflect and even to recreate our way of life. And then we have no option but to adapt with the new normal situations. So that first, so it's time for us to think the way we live our life, especially from health and nutrition point of view. The second point is, we should maintain or even improve the momentum that we have now, in which everyone, if I'm not saying, I may not be able to say everyone, but most of us have become more health conscious due to pandemic. So we really have to maintain this momentum to promote healthier lifestyle to everyone. And for some group of people who is less fortunate and less ready to cope this crisis, we may need to provide options to assist them more, and from both government and also us as a community. Yeah, I think that's all, Dr. Jane. Thank you.
Thank you, Dr. Ade. Thank you to both our speakers. On behalf of CIRCA, led by our director, Dr. Glenn Gregorio, we would like to express our sincere gratitude to Dr. Ade and Assistant Professor Jad for taking the time to join us today. It has been a pleasure to have both of you with us this morning. So that ends our webinar. But before we close, please let us know what you think about today's Solve webinar by following the link to a quick feedback form that is posted in the Facebook live stream video of this webinar, as well as in the chat box of this Zoom meeting. The same link will direct you to the request form for the e-certificate, and your feedback will help us improve our online learning events. Please note that we will only accommodate requests for e-certificates within 24 hours after the end of this webinar. Kindly wait for your e-certificate to be issued at least within a month, as we receive a lot of requests for e-certificates. So thank you for your kind understanding and patience. Let us help one another get through this COVID-19 pandemic. We hope that as we go along, we will be able to create a community of better, bigger, and smarter farmers and farming families. Once again, this is Jean Labios for CIRCA. Have a good day, stay healthy, stay safe, and goodbye, everyone. Thank you, Prof. Jad. Thank you, Dr. Ade.